Hi there, my name is Mike Brent. I'm a physiotherapist at Complete Physio. I work here at Angel and Swiss Cottage. I wanted to talk to you guys today about ACL injuries, post-op ACL surgery, both from a physiotherapy point of view, but also from a patient's point of view, because I ruptured my ACL in January, had my surgery in March, and now I'm just getting back into my sports. So as soon as I had my ACL surgery, I knew straight away that I wanted to get straight back into the same level of sport at the same intensity and the same standard that I was pre-surgery. Again, a lot of the statistics, if you look at it, show that actually the rate of people getting back into sport at the same level is pretty low. Only around 65% of patients who are not elite athletes tend to get back to exactly the same standard. So I just wanted to give you a quick overview of essentially my treatment pathway and what I did to get me back to the state I'm now, which is 8 months, and just about getting ready to get back into the same level of rugby that I was beforehand. So the first 2 weeks post-surgery is just about getting the knee settled again. I say the same to everyone in this position. Don't worry about trying to force anything. All we want is you to recover from the surgery, get on top of your pain, get on top of your swelling. And we look for a few really important functional markers in these first 2 weeks. And for me, the biggest thing is getting full extension back. That's getting your knee fully straight. Because we know if you don't get that marker by 2 weeks, people tend to struggle and get what we call a stiff knee going forward and be quite difficult. So for me, the first 2 weeks is about getting full extension back, trying to get your muscle to activate and recruit again, because you will find you can't quite get those muscles, especially the thigh and the hamstring, to contract again. It slightly depends if you have the hamstring graft or the bone patella bone, but still we're looking for these same markers. We also want to get rid of the swelling as much as possible and start to normalize your walking pattern, your gait. So I say the same to everyone again at the first 2 weeks. Don't force anything, don't expect much, just try and get a nice basic level of function back. From week 2 to 6, again, these are rough time frames. If you work with any decent physio and any surgeon, they will say to you that everything should be function and symptom driven, but we do want to respect the biology and the time frames it takes for things to heal. So from week 2 to 6, again, my goal, and the goal for most people should be, you should look normal. By that I mean you should have a normal walking pattern, you should have at least full extension and well over 90 degrees flexion so the knee can bend quite nicely. You should have good muscle recruitment and you should be able to walk around, and if you were doing general everyday activities, no one should really know by this point you've had your ACL reconstruction. So really we look at pushing the range of movement a little bit more, working more on that muscle recruitment and the strength that you have, normalizing your gait pattern, and just starting to address some of the other issues depending on exactly what surgery you had, whether you had the meniscal repair, whether you had the hamstring or the different graft variations. But by 6 weeks, just aim for looking normal. From the next 6 weeks to around 3 months, now we're looking for our strength program. So here we're really looking to try and get that muscle to fully recruit from what we call the neuromuscular point of view. So your brain and your muscle work together and it can fully activate and you can do normal movement patterns and you can really contract that muscle well. We then look at doing some weighted work. This is going to be a combination, and it's important you get both what we call open chain and closed chain exercises. The difference is whether your foot is in contact either with the floor or with a pad like a leg press. It's important we do open chain exercises when the foot's not connected, because this really helps you isolate and work the quad muscle itself. Because when you do closed chain, you can use your glutes and your calves and other muscles to help, but sometimes that means you don't fully use that thigh muscle. So we're going to do a combination of both open chain, closed chain strengthening exercises. Equally, this is when we get a bit more specific, whether you had the bone patella bone or the hamstring graft, because now we want to start loading those tissues as well and start getting them back into a normal level of function. So by the time we hit that 3-month period, again, roughly depending on who you are and what's going on, we want you to have really good levels of strength. There should be no real swelling. You should have pretty much full range of movement, if not at least 120 degrees flexion. And you should be able to walk quite comfortably and feel quite settled in the knee itself. From 3 to 6 months, now we're looking to do a little bit more sport-specific work, and we're looking to get you back into some kind of impact and running mechanism. So now we want to start looking at your ability to control a landing, your ability to hop, a little bit of change of direction work. You should be slowly building from a slow jog up into a decent level of running at this stage. And it's really about what we call the neuromuscular control now, because we should have a good baseline of strength. We should have a good range of movement available in the knee, but now what we really want to do is get the knee starting to move a little bit more reactively, start to be able to cushion and control landings, and get you doing some more dynamic and ballistic work. From the 6-month mark to the 9-month mark, this should really be targeted sport-specific rehab. This is where I find a lot of rehab isn't done particularly well, and it can be quite generic. But really now it should really be sport-specific. So if you're a netballer, you should now really be looking at your ability to jump, land, pivot in small directions, short bursts of speed, quick changes of direction. If you're looking at tennis or football or rugby, again, the demands on the knee are very different. So this is when you need to be working with someone who understands the demands of your sport, the demands of your knee and what it has to do. You also need to be looking at stuff like reactive work. So you cannot pre-plan the movement, which means the knee has to do a little bit more work and you can't go into it expecting to know what the outcome is. Equally, this is when we do what we call perturbation training. So this is when, if you're doing a certain movement, whether it's jumping, landing or pivoting, you can have contact and you have to be able to kind of change and adapt for that. Especially obviously in these team contact sports, you can never always just land comfortably and never push and run and move in a direction you want to. Sometimes it is dictated by someone else, and at this stage you really have to be comfortable accepting these knocks and these pushes and still be able to land and control these movement patterns. If you have any questions, any issues, please drop me an email, like the video and the blog, and contact us at Complete or me directly anytime.
Well, we do hope you enjoyed the video, and if you have found it useful, then please do subscribe to the Complete Physio channel and like it and even make a comment.